Okay, hi, Paul Slack is Good
Appreciate
News
it.
Planet. Actually, February is Heart Month. Okay. Well, actually, I got a heart behind me with this chroma key. You can see the heart. That's what I usually have. And behind me, if I don't go with this sky background, we like the heart. The heart is it's a good item, right, Dr. Baum? We're fortunate to
I
have
think
it.
it's a great item. Uh,
Okay.
yeah, we're quite fortunate. It is our most important organ.
Is it? All right. Well, we'll talk about it. We're going to create heart
Well,
healthy habits. Why to lower bad cholesterol when your best isn't enough. Okay. All right. And Dr. Baum is a MD and a cardiologist and chief medical officer of Excel Medical Clinical Trials. That's interesting to me. Clinical trials. So I believe we have a medicine here. I guess you did some clinical trials with it. Is that right?
I did. Yes, that's correct.
All righty, good. So tell us a little bit about, well, what is a clinical trial? I mean, we talk about clinical trials. I don't know if people really understand what that is. And then let's talk about cholesterol, please.
Okay, clinical trials are very, very important. They're the way we get to understand whether drugs are safe and effective, and we get them across the finish line if FDA approves them. Um, you know, uh, these clinical trials have many, many patients across many, many states and countries, actually, that participate in order to determine whether or not these medications are effective and can be utilized in clinical practice. We are very, very fortunate. The really good news is that very recently there was the approval of one of these medicines, a medicine called leqvio, to lower cholesterol, lower specifically LDL cholesterol in patients with established atherosclerotic cardiovascular disease or a genetic disorder called familial hypercholesterolemia. And the medicine's used on top of statins and diet.
On top of statins and diet. Is that right? Did I understand that?
Correct.
Okay, because I'm on a statin. I've been
Yes.
on a statin for, maybe 15 years, I guess. I don't know, a long time, over 10 years. And believe it helped me. And when my doctor said statins, but I tried one initially and it hurt my arm. And the first time I used the statin, and then he changed the statin, and the statin has been wonderful. My cholesterol, LDL, HDL are lowered. And he said he used the word triglycerides. What are triglycerides?
Yeah, so triglycerides are another type of fat that's in our blood. But you brought up a really interesting point that I think is highly relevant, and that's your experience with statins. It's actually, you're not that uncommon. So sometimes we have to try multiple statins on patients to get the right one. Statins are drugs that have been around for decades. They're very, very effective. They have a great body of literature behind them. And they are really, truly the mainstay of therapy. I'm glad you cited what you just did to help others get on their statins and stay on their statins when indicated.
I'm a good example. That's why I'm good at interviewing because I've tried a lot of things. I'm like a car motor. We'll take this out. We'll try that. We'll try that. What does ASCVD stand for?
So, atherosclerotic cardiovascular disease is the most common form of heart disease, and it's a disorder where we lay down plaque in the arteries that feed our hearts and our brains. And this can lead to heart attack and stroke. It's very prevalent, very common. One of the most important, probably the most important cause of atherosclerotic cardiovascular disease is high cholesterol, specifically high LDL cholesterol, which we've often dubbed the bad cholesterol. When LDL cholesterol is high, the risk of developing this plaque in these arteries is greater. When it's low, the risk is lower. So we really try very hard to lower the LDL cholesterol among the many tens of millions of people in the United States who suffer with this problem. We treat in my practice, so look, I'm a preventive cardiologist and a clinical lipidologist. So, I spend a lot of time on this, and I'm also a clinical trialist, a researcher. We spend a lot of time on this, and we treat according to risk, is what we say. So our highest risk patients we treat most aggressively, and we try to get their LDL down as low as possible often. One of the interesting and unfortunate aspects of what we find in clinical practice is that oftentimes, up to 80% of cases, in fact, of patients who have atherosclerotic cardiovascular disease who are on statins for LDL lowering have an inadequate, a suboptimal result. In other words, their LDL remains too high, even on statins. And then in these patients, we need to turn to something else.
Uh-huh. All righty. And before there's something else. So the words hardening of the arteries. What does that mean? Does that mean instead of having good space in between, something hardens in there? Fat hardens in your
Right,
artery?
so when we get plaque, yes, so when we have plaque deposited in the arteries, initially it's filled with fat and cellular debris, inflammation. I hate to use this analogy, but it's pretty appropriate. It's kind of like a pimple, actually. It's filled with pus. And as the plaque heals, it calcifies, it hardens. So hardening the arteries is often what we call atherosclerotic cardiovascular disease, hardening of the arteries.
So, like, if you make a soup or you make a chicken, okay, we grew up with chicken. A lot of when you grow up and you have what we call the schmaltz. When we have the fat that comes off of the food, that fat, which we pray gets dissolved, so it doesn't get dissolved in an artery. Is that what happens? And so it clogs it enough that
Yeah, so really, again, very interesting question. The point is that actually specifically LDL is the carrier of cholesterol that goes into the arteries, brings that fat, that schmaltz, into the artery, lays it down inside, and forms the plaque. So that's what goes on. So you're right. Dietary modifications can be really, really important and can reduce our cholesterol. Oftentimes not enough, and that's why medication's needed. And then in other circumstances, when there's a genetic disorder like familial hypercholesterolemia, which occurs about 1 in 250 people, the dietary changes are much less effective. Excuse me.
so now you have. I always call them a miracle. I believe in medicine, and I believe in research, and I think it's wonderful. I thank you. You're heroes for coming up with something that's going to save somebody's life. Because heart disease is not a fooling around. This one cardiac arrest, this one, and you go quick. But I'm talking real reality. I mean, they say, so what? Walk around with an aspirin. I don't know what an aspirin does, but let's say. So what has is this Novartis? I think is also involved with this opportunity to speak to you and learn more. What have you all discovered here, and what is the FDA approved?
Yeah, so first of all, let me just say this is why I partnered with Novartis, because of the opportunity to spread the word about the prevalence of atherosclerotic cardiovascular disease, the problem with LDL cholesterol, the connection between the two. So I'm very happy to be here speaking with you about this. You clearly have a great understanding of this issue, and I appreciate that very, very much. Very, very recently, FDA approved a novel medication called leqvio. It's a new lipid-lowering drug that lowers LDL cholesterol through a different mechanism of action, and it's administered via injection. It's given every 6 months after an initial dose, and then one at 3 months. And it's got many attributes, not the least of which is the convenience. Because if you think about it, most patients will see their doctor twice a year. Well, you go into your doctor twice a year, now you get your injection. Adherence then becomes no longer a problem. People know they're getting their medicine and they have a sustained and effective result, lowering LDL up to 52% in some studies, at up to 17 months out. There are, of course, potential side effects with all medications. In this case, injection site reactions being the most common one, and I would, highly recommend that everybody speak to your physicians about this. The medicine's used on top of statins and diet, and is just really good news. You call it a miracle. I guess it's fair. That's a fair assessment. So we're thrilled to have it available in our armamentarium. I would suggest that you look at, and your viewership look at leqvio.com to get more information. That's leqvio.com. There's tons of information. And also please speak to your physicians about this. I really encourage everybody to be proactive, to be your own advocate, because if you're not your own advocate, nobody's going to be your advocate for you. And it would be beneficial for everybody to take February Heart Month, very, very seriously and make actionable changes. Thank you so much for having me on today.
Good man. Thanks so much. Appreciate the opportunity.
Thank you.
Take care. Bye-bye.
Thank you.